Good morning.
Morning.
We are here today with Cristy Gupton. Cristy is president and founder of Custom Benefits Solutions, located here in Morganton, North Carolina. And Cristy, how long have you had that position? And tell us a little bit about that company.
I started Custom Benefit Solutions way back in 2006. But then we started a family, and so I felt that I needed to rearrange my focus, and I did go to work for some other folks, a couple of different places, and then in 2015 it was time to get that logo back off the shelf and start afresh, and so that has been about 3 years ago. And we help employers with all aspects of cost containment in their employee benefit programs. But I spend an incredible amount of time looking at each of the moving parts of a health plan and bringing in high performance solutions that drill down on overpaying for healthcare services. So that really helps on a number of different levels. It helps both public and private sector employers to stabilize a line item in their budgets that right now is on a runaway train.
So you mentioned the word cost containment, a fairly big concern in these days with healthcare, as it were. Is that correct?
Oh yes, it generally is about the number 2 or 3 line item on any P&L statement. You know, when you look at how you're bringing in revenue as opposed to how you're spending it out, when the healthcare line item is on the trend line that it's on, and most of us believe that it's being overpaid by about 40%.
40%.
40%. So if there was a way to take that trend and bring it down to a stable level, who wouldn't want to do that?
Absolutely. And that's really what your company is aiming to do.
That's
so
right.
talk a little bit more about what you can do to help people and how you are helping people.
Sure. You know, we look at that all kinds of ways that money is spent on healthcare, whether it's at the procedure level or whether it's paying those medical bills. Are those medical bills accurate? Are there errors on them? Are there things that just don't square with best practices? We've caught we've caught pregnancy tests done on men, or at least billed for.
Wow.
Right? We've caught circumcisions billed for in an inappropriate manner.
Right.
We've just caught all sorts of things, and they could be just computer errors or not. We don't know, but we'll review those medical bills for accuracy and make sure that our client is only paying what is correct and accurate for those procedures. That right there, as a very baby step, it's not disruptive to the organization. It doesn't mean you have to change insurance companies to do that. It just means you have to look at medical bills.
Absolutely. And most people, including myself, if the doctor sends a bill, I take it for what it is, and one way or the other, that bill has to be paid.
That's right.
My goodness.
That's just one of about a dozen different high performance tools that we implement in, to any of our client relationships. We do a lot of advocacy and directing employees to high quality care. It's counterintuitive, but you think when you opt for the highest quality, you better be willing to pay the highest price. But in healthcare, it's not the case. When you opt for higher quality, you almost every single time default to the lowest price on the range.
My goodness.
And if it's not the lowest, it's somewhere in that lower quadrant, because those specialists, those true experts in that particular procedure, they've done them hundreds of times of times over the years for the last 20 years. And so that's thousands and thousands of times they've had practice at perfecting the art of that particular procedure, so they don't make mistakes anymore. Their infection rates are low, their readmission rates are practically zero. The number of days that it takes that employee to recover from that procedure is minimal. And so we do a lot of work finding the highest quality. and steering employees to those resources.
Okay.
That saves the plan an incredible amount of money.
Yes. Now, if for folks that are interested in your services, how do they contact you?
So absolutely check us out online at www.custombenefits.work.
.work.
Because custom benefits works.
And it absolutely does.
It does. And I personally have a presence on Facebook, LinkedIn, Instagram, Twitter. So not that that's where I want people to go, but if they want to get a better feel for some of the philosophies I have about transparency in healthcare pricing and how we do the work that we do and some of the outcomes that has, they can learn more there. And certainly just give me a call. We can always talk. I love to talk.
Well, great. Well, Cristy, again, thank you for taking the time to be with us today. You've shared some really interesting facts about what you do and the services and the benefits that you can provide to folks out there in the community to try to get a handle on some of these healthcare costs and to improve their lives. What I find interesting about you and something I've been learning about you is that you have used your profession as somewhat of a calling for some things that are really close to your heart. Can you tell us a little bit about what that is?
So, in the last year, I really kind of latched on to the opioid crisis as something that I wanted to tackle, even though I didn't really have any connection to it other than how it was affecting my hometown community. And I didn't even realize how that was happening until I heard that directly from my sheriff. Wow. From a law enforcement perspective, his department was just struggling to dedicate the kind of resources to the crisis and the way that it was affecting our community. And that really spoke to me and resonated with me. And I kept thinking the whole time I was hearing those stories, to the extent that opioids are paid for by an employer-sponsored health plan, we have tools. To mitigate those risks, and why are we not using them? So, I left that experience realizing that the employee benefits community had completely been asleep at the wheel while communities suffered.
Wow.
And I wanted to do something about it. So I did kind of go on a mission to find the right way to break apart a health plan and piece its pharmacy benefit away from how those benefits are normally delivered and paid for, and use technology to identify where the problems are happening.
Okay.
And so I curated a number of vendors that I still work with today that do great work. A couple of technology companies that developed algorithms where we can just analyze claims data, and in a matter of days, I can, in a very HIPAA compliant way, but I can provide insights, not divulging anyone's protected health information, but insights to the employer where they need to make some strategic changes to the way prescribing is paid for, especially when a narcotic is on the table. But that, in and of itself, could save lives right there.
Absolutely.
Not to mention money. I mean, if we've got a situation, especially here in Western North Carolina, not a lot of folks realize it, but the manufacturing community is a target.